It is a great satisfaction to greet you again. I hope you and your pet are well. Today we will talk about the following: intestinal obstruction in dogs, symptoms and treatment. Whether on a walk or at home, our dogs can ingest the strangest objects. Although foreign body ingestion can be a common cause of intestinal obstruction in dogs, it is not the only one. We will talk about other causes, as well as the symptoms and treatment of gastrointestinal obstruction. 1. What is intestinal obstruction in dogs? An intestinal blockage occurs when something prevents the normal passage of digested matter through the large or small intestine. These blocks can be partial or total. Although both can cause problems, generally speaking, the greater the blockage, the worse the clinical picture. There are two main types of intestinal obstruction in dogs. Mechanical obstruction, when something physically prevents the passage of digested food through the intestine. It occurs most often in the small intestine and is considered a common cause of acute vomiting in dogs. Functional obstruction, when the intestine is not working properly for any reason, causing the cessation of peristaltic flow and the accumulation of digested matter to form a blockage. When the cause of intestinal obstruction is mechanical, there are many risk factors. For example, if the object has sharp sides, it can cause lacerations to the internal tissue of the dog's gastrointestinal tract. If it results in internal bleeding, it can be potentially fatal. For functional obstruction, there will be an underlying problem or condition that results in the obstruction. Once this underlying problem is treated, the flow of digestion should return. 2. Causes of intestinal obstruction in dogs. We uncovered some of the most common reasons a dog's intestines can become clogged, depending on the type. Strange body. Since dogs use their mouths to explore their environment, it's common for them to ingest something they shouldn't. Tumor. Whether benign or malignant, abnormal tissue growth can press against the intestine and restrict flow. Intestinal inflammation. This disease has many potential causes, but they all result in chronic inflammation of the intestinal walls. It is this inflammation that causes the blockage. Infections. It is a possible cause of acute inflammation that obstructs the intestines. A dog's immune system reacts against pathogens that cause an infection, usually bacterial, viral, or fungal. Inflammation of the intestines causes the obstruction. Hernias. When a part of the intestine pushes out of its normal abdominal cavity, it can cause an obstruction. This may be due to the segment of intestine folding in on itself, causing a strangulation obstruction. Medicines. The use of certain medications can result in various side effects. A common side effect of many medications can be blockage. 3. Symptoms of intestinal obstruction in dogs. The following symptoms are some of the symptoms that are specific to the blockage itself and can occur whether the blockage is partial or complete. In partial intestinal obstructions, the dog will have intermittent vomiting and/or diarrhea. Complete intestinal obstructions will cause the dog to have a sudden onset of acute abdominal pain and constant vomiting. In these cases, the dog cannot defecate or expel gases. If the obstruction affects the blood supply to the intestine, intestinal strangulation occurs. This situation is capable of causing gangrene in the affected part in a matter of hours. Intestinal obstruction can cause gastric torsion or bloating. We will see that the dog's belly has hardened and he will have pain, nausea, restlessness, respiratory distress, pale mucous membranes and other concurrent symptoms. Any symptoms such as those mentioned is a reason for veterinary consultation. 4. Treatment of intestinal obstruction in dogs. The treatment of an intestinal obstruction will consist of removing the obstruction. Treatment is likely to require surgical intervention. It may be possible to relieve the obstruction through drug therapy, but this will depend on the nature of the obstruction itself. If the cause is due to the side effects of a drug, cessation of therapy with this drug can stop the blockade. However, sometimes the blockage can remain even after the dog stops taking the medication and surgical intervention will still be required. The vet may also need to remove a part of the intestine if it is damaged enough and perform a resection. Once the blockage occurs, it poses a serious threat to the dog's body. The dog's clinical picture can change rapidly and the problem can become fatal. For this reason, there are no home remedies for intestinal obstruction in dogs. We will have to take the dog to a vet to diagnose it and he will administer the correct treatment. It goes without saying that we should never try to make an incision and remove the blockage ourselves. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. take care of yourself and your furry friend, a hunt, and until the next video,